In 2010, the Alliance worked with the Scottish Government to publish a report called Emotional Support Matters. It said that the 2 million people with long-term conditions in Scotland want holistic support that includes emotional and psychological support as part of an integrated service and not as an add-on. In 2013, NHS Education for Scotland produced a resource for health and social care staff called Emotion Matters. The aim is to help practitioners to work together with people with long-term conditions to build relationships and offer empathy and support for self-management. NHS Education for Scotland wanted to better understand the needs of patients with long-term conditions in order to provide insight within a new learning tool for health professionals. They asked the Alliance to enable them to gather responses and experiences from patients with a particular focus on their emotional and psychological well-being. This also included examining their life experience and reviewing the resource created for NHS Education for Scotland. Marion lives with chronic pain following a road accident in 1989.
It's difficult to say now, it's such a long time ago, but I went into a state where I think I was enveloped in pain and I felt as though I'd lost myself. I became so I didn't want to go out of the house. My mother luckily lived with us at the time. I was completely ashamed because my mum was having to do things for my husband and myself.
Alan lives with an ileostomy for ulcerative colitis and he also has multiple sclerosis.
And the guy with a coat, coughs it out, we're pretty sure you've got primary progressive multiple sclerosis for which there is no treatment. Now, I probably didn't hear the "it's not going to kill you" bit.
Kingsley lives with type 2 diabetes, chronic back pain and COPD.
Well, just having been told that you've got a condition which is incurable is quite a blow in itself. It's not just work I had to give up. I used to coach rugby. I used to have a dog. I mean, the dog needs a lot of exercise and I couldn't give it that exercise.
Lauren lives with Crohn's disease.
I just kept thinking to myself, so what happens now? What do I do? How do I actually cope with this? How do I even talk to her? Because I had no idea what it was, and I think I just went on straight online when I got home. Just totally wiped out Google and tried to find out exactly everything about it.
A common theme that came through very strongly when speaking to people was the impact of working or losing employment on people's mental well-being or self-esteem. Marion used to be a biomedical scientist doing haematology and blood transfusion.
I actually ended up having just over a year off work at that time. At one stage I snapped and I thought, God, you didn't let me have children, you're not taking my work away from me, I am getting back to work. And I fought like tooth and nail. It's hard to say how it happened, but the pain just got so that it was increasingly worse. No pain control was having an effect. I was going to work an hour early and lying down on one of the donor beds when I got to work, working, and then during my dinner hours having another lie down.
Kingsley used to work in community development.
I was expecting to be promoted, not retired. I had a career which came to a sudden halt, which had a great emotional impact on me, but that's not mentioned anywhere in my medical notes. I took up voluntary work largely as a replacement for work.
Lauren is currently on long-term leave from her job as an administrator, following a number of surgeries and hospital admissions.
I was absolutely heartbroken, devastated. There's no other words to explain it. I was so scared of them saying, by the way, there's just no jobs. I'm going to have to let you go. But the days where I'm feeling quite good about myself, it's really quite hard. Because you want to be active and you want to be doing stuff because you feel good. You look, yeah. I don't look sick all the time, so people just assume, you know, I look alright, you know, she must be alright, why is she not working? Things like that, which really quite annoys me.
People talked about how all health professionals could provide holistic emotional support. Conversations with people and the ability to ask questions about feelings were seen as essential.
It makes you feel an awful lot better if you're listened to completely. And there's a definitely need to understand that emotions really do impact on chronic illnesses.
It's reassurance that I want. It's listening. It's empathy that I want. I don't think being anxious, panicky, depressed, fearful about having multiple sclerosis is mentally is a mental illness. You know, I think it's normal. I think I would be mentally ill if I wasn't anxious about having MS. I think that counselling can be really effective. Talking to somebody can be really effective. It doesn't have to be with a counsellor. I would urge health professionals just to dig deep for their own strength, to be in the presence of other people's distress, of patients' distress, to find ways of handling their embarrassment or their awkwardness. And it's not just tears, it's other difficult subjects like sex.
I think that they really need to ask real questions about what is going on, how is your actual pain, how is day-to-day life, what do you want to do?
People said they wanted to access a wide range of emotional and psychological support, but often this was not delivered by health services. They also talked about the importance of family, peer support and community-based services to help them self-manage their conditions.
I do feel having a long-term condition, a lot of friends aren't able to support you, and it is very important having people who also have long-term conditions that have a better understanding, and they're definitely needed as a support network. You've got people who'll help you when you're feeling bad, but sometimes when you're feeling bad, it's good to help somebody who's feeling slightly worse or in a different place.
Well, I'm lucky to have a good relationship, and the key support that I have is from my wife. But it's important that we both have other sources of support too, her as well as me, and she seeks out and gets help for herself, which is really important to her, but really important to me as well. You know, that about 8 of us meet once a month, and we're noticing that we've got very similar stories. Our symptoms may be different, our diagnoses may be different, but we're processing our losses, we're dealing with our pain or our loss of function. That whole self-management notion and the programs that have been rolled out to support that are really valuable.
My wife, she's a wheelchair bound. Well, she's also got diabetes. She also suffers from the emotional impact. She was a social worker. She lost her career through it the same as I did. I went on a course in writing and performing comedy and did a few gigs there, including the Edinburgh Fringe. And again, I made friendships there that were people with other long-term conditions other than diabetes, which was quite good. It gets you out of depression if you look on the funny side of things.
I've got a lot of friends with Crohn's, I have a lot of friends with colitis, a lot of friends with IBD all over the UK, and they're there 24/7, and I get the biggest support from them. And that's meeting people online, through the likes of Facebook and Twitter, and that's just through luck, really. You need to be given something. If it's a number, an email address, or a Facebook account, you know, it's something. You know, it gets someone to talk to somebody else.
People with long-term conditions have lives, dreams, ambitions, families and friends. Sometimes a long-term condition impacts on life, and sometimes life impacts on a long-term condition. But acknowledging the wider aspects of someone's life is the role of every professional. If you are a health and social care professional working with adults with long-term conditions, you can access the Emotion Matters resource online. For further information about emotion matters, contact the Physical Health team at the Psychology Directorate, NHS Education for Scotland. 2 Central Quay, 89 Hyde Park Street, Glasgow, G3 8BW. You can find out more about the Health and Social Care Alliance Scotland's work on emotional and psychological support at www.alliance-scotland.org.uk.